Meet Rambu and her friends. They live on the island of Sumba in eastern Indonesia. Like children in public school around the world, Rambu and her friends represent a vulnerable population who are at high risk of being unable to fully participate in their education. In Sumba, like in so many communities, illness, family responsibility, care for siblings, and other social pressures are common reasons for student absenteeism and low participation in schools. Each day of missed school risks long-term academic performance and opportunities in the future. Rambu is absent from school today. She has actually been absent from school for 4 days. In most communities around the world, this might go unnoticed. School attendance for children in Sumba and for most children around the world is recorded on paper. And as merely a static data point, attendance is unable to be utilized for identifying children in need of immediate health or social service referrals. In Sumba, when children like Rambu are absent, the teacher is expected to pick up on this fact and follow up with her parents. In other communities, volunteers or paid community workers may check on homes sporadically and assess for sick children. And in fact, we have a problem. Rambu is absent from school today because she has a fever. Her parents recognize that she is sick and should not go to school, but how could they know that Rambu has malaria? Without simple and effective tools to track attendance and facilitate prompt home or school-based evaluation, children like Rambu are at risk of falling behind, dropping out of school, and experiencing delays in the engagement of their medical care. Luckily for Rambu, her community is piloting the Waliku software and system, and her absence has not gone undetected. Meet Waliku, or My Guardian in Indonesian. Waliku is a mobile application, comprehensive database, and integrated system built to address the needs of Rambu and her friends. With Waliku, absence is used as a surrogate marker for potentially sick children in need of help, or children with social factors preventing them from attending school. At the beginning of the year, Rambu and her classmates were enrolled in the Waliku database. Since that time, Rambu's teacher has been taking attendance on her mobile phone app. The Waliku database then recognizes when children have been absent from school for consecutive days. As soon as the database recognizes that Rambu has been absent from school for the 4th day in a row, she is added to the task list of the teacher or community worker who's responsible for performing a home visit. When a home visit is performed, the Waliku app guides the teacher or community worker through a series of questions to understand the reason for the child's absence and to screen for high-risk symptoms and signs needing immediate medical care. For those children with high-risk features, the Waliku system triages and sends alerts to the necessary healthcare providers. The Waliku system even has first aid treatment algorithms which guide teachers and community workers in the basic care of a sick child in the home or school. In communities where no one is able to perform a home visit, we're building software that can auto-dial or send a series of automated text messages to the parents to query the reason for the child's absence and assess for children requiring evaluation by a health provider. Insufficient and delayed care can have devastating results. This was seen on the island of Sumba, where 7 child deaths occurred over the course of 2 years due to lack of early detection and delayed treatment. Thus, by digitizing school attendance and using absence as a dynamic data point, the comprehensive Waliku system assesses and triages school children in need and facilitates prompt follow-up care. The underlying reasons for school absenteeism and illness at a local level are often unknown, but can be better understood by linking each individual absence to a social cause or illness and then aggregating that information to recognize the major threats to a community's children. Now that Rambu has received the help that she needs, her school has started to recognize that they have a high malaria burden. Rambu's school has been accessing their customized dashboard where they see absence data, as well as health and social factors leading to missed school days. With that data, schools, clinics, and communities can advocate for interventions and plan for large-scale control measures. For example, Rambu's school implemented class-based teaching on removing standing water and handed out bed nets during the month of May, and then tracked the success of their program during the month of June. Similar monitoring can be done at the district, regional, and even national level. By digitizing attendance and facilitating follow-up with robust data collection, schools, communities, and governments will better understand the factors preventing effective learning and good health in school children. With the support of the Save the Children Innovation Pipeline grant, the Waliku system will become a reality. Over the next 6 months, adaptations to the prototype software will be made based on results of a feasibility study that was performed in March of this year in Sumba. With planned phases dedicated to software adaptation, local engagement, and full-scale pilot of the system, we plan to learn, grow, and affect change for nearly 1,000 school children in Sumba during 2018. All the while, our focus will remain on sustainability, scalability, and development of standalone tutorials and trainings that will allow for future implementations that will require much smaller financial and technical investments. By digitizing school attendance and giving communities the simple technologic tools to address children who are absent from school, the Waliku system will simply and effectively address absenteeism, get sick children the help they need, and assist schools in understanding the major factors keeping children from being healthy and successful learners. Thank you.